Hi, this is Sharon Holthouse, and I will be talking about heart valves today. We're going to take a look at where you find these valves in the heart. We'll look at what closes and what opens these heart valves. We'll learn about the heart sounds that are produced by these valves. And we'll also talk about some potential problems with these valves that can cause what we know as heart murmurs or abnormal heart sounds. Before we start looking at the location of the heart valves, I wanted to quickly review the flow of blood through the heart. The primary function of the heart valves is to ensure that blood flows in one direction through the heart. So let's just do a quick review here. Here's the right side of the heart, and here is the left side of the heart. We'll start with the right side. So we have blood returning from the systemic circuit from the body via the inferior and superior vena cava into the right atrium. Blood then moves to the right ventricle where it's ejected through the pulmonary trunk and then travels to the lungs to drop off CO2 and to pick up oxygen. Blood then returns to the heart, now to the left side, first to the left atrium via the pulmonary veins. It then moves to the left ventricle and is ejected through the aorta so that this oxygen-rich blood can be carried to the body cells. All right, so now that we have the flow of blood very clear in our mind, the first valve that I'll talk about is the right atrioventricular valve. And this valve is found at the junction between the right atrium and the right ventricle. This valve also goes by the name of the tricuspid valve because it's made up of three cusps or flaps of tissue. This valve is going to be open during diastole. Now remember that the cardiac cycle of the heart is made of a diastolic period when the heart is relaxed and is filling with blood. And then it has a systolic part when the heart is contracting and ejecting blood. Okay, and diastole and systole again typically refer to the ventricular activity of the heart. Okay, so during diastole, the heart is filling with blood, so we have blood returning from the systemic circuit via these major veins, the inferior and superior vena cava, into the right atrium, and that blood is then going to move through the tricuspid valve into the right ventricle. Okay, so that valve has to be open in order to fill this right ventricle with blood. When the ventricles contract or during systole, this valve will close. We do not want blood flowing back up into the right atrium. Okay, this would not be a very efficient system. So closing of the tricuspid valve is going to force blood in the direction we need it to go into the pulmonary trunk where it can then go to the lungs. On the left side of the heart, there's also an atrioventricular valve. And this valve, of course, is between the left atrium and left ventricle. It is sometimes called the bicuspid valve because it's made up of two flaps or two cusps of tissue. And it's also known as the mitral valve. So three names to choose from. Now this valve, similar to the right side, is open in diastole. So remember, on the left side of the heart, we have blood returning to the left atrium from the lungs via these four pulmonary veins. And as the heart is relaxed, blood will move through this open valve into the left ventricle so that we can fill this left ventricle up with blood during the relaxation part of the cardiac cycle. When the ventricle contracts, or systole, this valve will close. So similar to the right side, we don't want blood backflowing or moving back up to the atrium. And this is going to promote the movement of blood into the aorta. So this is kind of hard to see because the pulmonary trunk obscures the aorta, but the aorta is passing in this direction right behind that pulmonary trunk. So when the ventricle, left ventricle contracts, it's going to force blood up this way and then into the aorta. There are two more heart valves that I'll talk about, and these are both called semilunar valves. There is a pulmonary semilunar valve that we'll look at first, and this valve lies at the junction between the right ventricle and the pulmonary trunk. Let me grab a pointer here. Okay, so here's the pulmonary semilunar valve. Now this valve is made up of three cusps or flaps of tissue. On this diagram it just shows two of them. The third has been removed with this frontal section view of the heart. Now the pulmonary semilunar valve will be open when the ventricles are contracting or during systole. So when this ventricle contracts, it's going to force blood through this open valve into the pulmonary trunk. When the ventricle relaxes, this valve will prevent the backflow of blood into the right ventricle. Okay, we just ejected blood out this direction during systole. We do not want it to just turn around and come back into the ventricle. And it's really this backflow of blood that catches in the cusps of this valve and forces them closed. All right, and then there's a semilunar valve that is associated with the aorta. So this aortic semilunar valve, you can see it peeking out right here. It's at the junction of the left ventricle and the aorta. And that valve as well has three cusps or flaps. So when the left ventricle contracts, this will force the semilunar valve open so that blood can move into the aorta. So it's open during systole or ventricular contraction. After that chamber contracts, it will relax or go into diastole so it can refill again. Now we don't want blood flowing back from the aorta into this chamber, into the left ventricle. So this semilunar valve will be closed. And again, as it's this backflow of blood, some blood will start to move back in the direction of the left ventricle and will be essentially caught by the cusps of the valve, and that's going to force the valve closed. I wanted to show you this diagram because it gives you a different view of the four heart valves. So we're looking at the heart from a superior view, and this shows us the plane that we're looking at. So the major vessels and the atria have essentially been removed. This is the front or the anterior side of the heart, and here's the posterior side. So you have your two semilunar valves, your pulmonary semilunar valve, your aortic semilunar valve, and then the right atrioventricular with the three cusps and the left atrioventricular with the two cusps. And this diagram here shows us these valves in their closed position. So when these valves are closed, these flaps of tissue are coming together so that their flaps are touching each other and they're closing the opening. So I just wanted to show you this because you can really visualize what a closed valve looks like. Now, when the valve is open, these flaps are basically going to be hanging down, and they're basically getting out of the way of the opening and allowing for the passage of blood. All right, so let's look at some of the specifics of the opening and closing of these valves. And the main driver of the position of these valves is pressure. They are structured in a way so that pressure from one side of the valves causes the flaps to move into the opening and block it, and pressure from the other side of the flaps will cause them to move out of the way and allow the passage of blood. So we'll look at the AV valves first. Again, these are between the atria and the ventricles. When the heart begins to fill during diastole, the ventricles and the atria are both relaxed. And at this point, as blood returns to the atria, to the receiving chambers, it will flow freely from those atria into the ventricles. And the valve cusps or flaps simply hang limply to the sides and allow for free movement of blood. Now we know that the atria contract to top off or completely fill the ventricles with blood. And this contraction of the atrial walls will increase blood pressure on this side of the valve to force, I guess you can see it better here, to force the cusps out of the way. Okay, so here we're seeing the direction of blood flow, and that increased pressure is moving those flaps out of the way so blood can flow into the ventricles. The closing of the AV valves is going to be caused by a change in pressure initiated by the contraction of the ventricles. When the ventricles contract, there's going to be an increase in blood pressure within those chambers. So now we have an increase in this blood pressure, and it's forcing the blood up against the inferior side of these cusps. That's essentially going to lift these flaps or cusps into the opening, and the edges of the flaps are going to come together to seal off that opening. Okay, and again, this is going to prevent the backflow of blood into the atria. Okay. Now, without the papillary muscles and the chordae tendineae, these flaps with this increasing pressure would just be forced backwards up into the atria, kind of like an umbrella that's blown inside out when you get a strong gust of wind. So what happens is the papillary muscles, these little mounds of cardiac tissue, they contract when the ventricles contract and tighten these chordae tendineae that are connected to the valve flaps. Okay, so these little cords hatchet down the edges of the flaps to prevent them from everting back into the atria. All right, let's look at the opening of the semilunar valves. So the semilunar valves again are at the junctions between the ventricles and the large vessels where blood is ejected. And as I mentioned, when the ventricles contract, there's going to be an increase in blood pressure. And here in the right ventricle, that's simply going to force these flaps apart to eject blood into the pulmonary trunk. And on this side, we're simply forcing the flaps, semilunar valves somewhere in here, forcing those flaps open so that blood can be ejected into the aorta. The closing of the semilunar valves occurs when the ventricles are relaxed. And so when the ventricles relax, the pressure within those chambers falls. Okay, so now we have a pressure gradient that's going to favor the backflow of blood in this direction. Okay, this is not desirable because we just ejected blood into these large vessels. So good thing we have the semilunar valves here. The blood essentially backflows into these little pouches. Okay, and that's going to bring the edges of these pouches together and close off that opening. Next, I'm going to talk about heart sounds. And these are sounds that can be heard when listening to the heart with a stethoscope. So there's two heart sounds. The first heart sound is related to the closing of the AV valves. Now to look at this a little further, I want to orient you to this diagram. So first of all, we have the ECG, the electrical recording of the heart. Here we have a diagrammatic view of the different phases of the cardiac cycle on top here. And then we have a recording of the heart sounds. So this is the first heart sound. This is often called lub. And then we have the second heart sound, which is called dup. Okay, and that second heart sound is related to the semilunar valves closing. All right. Now, let's look at this in a little bit more detail. So we start off with the first phase, and this is simply the filling phase of the heart when the ventricles are relaxed and they're filling with blood. In the second phase, we have the ventricles starting to contract and increasing pressure in the chambers. Sorry, I'm trying to grab a pen and it's not cooperating. Okay. And so again, that increased pressure against the AV valves closes them so we don't get the backflow of blood into the atria. Now that is when we hear our first heart sound, when the AV valves close, and they pretty much close simultaneously. Okay. When you get that closure, the sound that you're hearing isn't the flaps slamming together or anything like that, but what happens is the blood hits those closed valves and there's some turbulence there. Okay, and so the heart sound is actually caused by the turbulent blood flow that's caused by these closing valves. Okay. Now, if we continue to look at the different phases, in the third phase here, the ejection phase, blood is being forced out from the ventricles into the pulmonary trunk and the aorta. And then at the beginning of the relaxation phase, you're going to see that the semilunar valves close. Okay, so that's related to this second heart sound right here, the dup. Okay, and again, this is preventing the backflow of blood into the ventricles. So that's happening right at the beginning of that relaxation phase. Okay, again, this second heart sound is not caused by the flaps slamming together, but caused by the turbulent blood flow as blood hits those valves and starts to swirl around and makes some noise that can be heard through the stethoscope. We've just talked about the normal heart sounds that you hear in a cardiac cycle. So if you were listening to the heart with a stethoscope and listening to several cardiac cycles, you'd hear something like lup-dup, 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 lup-dup. Now, there are times when abnormal heart sounds are heard, and these are sometimes called heart murmurs. And a heart sound can be a sound that's in addition to the first and second heart sounds, or the first and second heart sounds may sound different than normal. So they might be louder or longer or have a different pitch. Okay. Now, many times people who have heart murmurs don't have any type of pathology or disease, and there's no problem with their valves. And these types of heart murmurs are called innocent ones. Oftentimes, children will have a heart murmur and then they simply outgrow it. So, again, sometimes different heart sounds are heard, but it's not indicative of a problem. However, it may indicate that there's a problem with the heart valve. There's a problem with it structurally, and that's preventing it from functioning properly. Okay, and if there's a problem with a heart valve, it may indicate a serious problem because blood is not flowing properly through the heart, and this could definitely interfere with cardiovascular function. So we're going to look at two causes of heart murmurs, and these would be of the dysfunctional variety where there's a problem with the valve. One is called stenosis, and this is a narrowing of an opening. Okay, so you could have stenosis of any of the valves, the semilunar or atrioventricular valves, but the valve opening is more narrow than it should be. And in this case, there's going to be a heart murmur heard when the valve should be open or when it is open. So, for example, if there was a stenosis in an AV valve, as blood was flowing from the atria to the ventricle and that part of the cardiac cycle, that narrowing may cause some turbulence, and that's something that could be heard through the stethoscope. Regurgitation or insufficiency. This is a problem where the valve doesn't fully close. So the cusps aren't completely meeting, and the opening may allow flow of blood in the wrong direction. Okay, so this type of heart sound is heard when the valve is closed. And again, it might not be fully closed because of this problem, but that's going to not cause any problem with flow when it's open. It's going to be something that's heard when it should be closed. Now that we've talked about these abnormal heart sounds, this is a good opportunity to test your understanding. So I gave you two situations. The first one's this problem with stenosis. The second one's a problem with regurgitation. And you're going to identify what valve or valves might be dysfunctional. So when you're thinking about these situations, you want to think about the timing of the cardiac cycle and if these valves should be open or closed during those times, and that should help you identify where these problems lie. So please let me know if you have any questions on those or any part of this screencast. I hope you have a great day and we'll see you soon. Thanks. Bye.